we're gonna move into our panel discussion now. So we can restart and reset, Dina. Welcome. You can introduce yourself again.
Thank you, Camilla. Yeah, I think I'll just start again for those who might have joined a little bit later. Hello and welcome everyone to the plenary panel, Family Hubs from Vision to Impact. Thank you very much for joining us. I'm Dina Koschorreck, a parent participation advisor for the National Center for Family Hubs, and I'll be chairing this event. First, I would like to thank all the speakers for joining us. We're very much looking forward to hearing your views on Family Hubs and some of your experiences so far. And we're also very keen to get as many questions from the audience as possible. Before we begin, I would like to tell you all a bit about the event structure. We will start by each panelist introducing themselves and briefly answering a question on Family Hubs. Each speaker will have about 2 minutes for that, and then I will give them a signal. And after that, we will open up the discussion to the audience. If you have any questions for our panelists, please write them in the Q&A. My colleague Paul Maxwell Rose will monitor the chat, the Q&A throughout the event, and I will pass your questions on to the speakers then. So thank you very much. Yeah, first we will hear from Marc Rooney. Welcome, Marc. Could you please briefly introduce yourself and tell us what problems do you think Family Hubs can solve?
Hello, everyone, and thank you for joining us. So I'm Marc Rooney. I'm the Deputy Director responsible for Family Hubs at the Department for Education. On the question, as you'd expect civil servants to do, I'm going to refer back to the Minister's speech this morning, which highlighted how local authorities are using the Family Hub model to make progress on those underpinning principles of improving access, connection, and relationships. And the Minister is also very clear about the importance of delivering on the critical start of life agenda that Dina has just spoken about through our work on Family Hubs.
Thank you, Marc. That was very interesting. Our next speaker is Denise Beavers. Hi, Denise. Could you also introduce yourself and tell us what difference you hope Family Hubs will make for children and families?
Hi, good afternoon, everybody. My name's Denise Beavers. I'm a service manager in Doncaster Authority for the 12 family hubs that we have in Doncaster. I was part of the implementation and development of the family hubs when we transformed our children's centres into family hubs. I think for me, the difference family hubs can make for families is by being the place to go to for families, it supports families to function effectively, giving children the best start in life. We've heard that phrase a lot, haven't we, today? But certainly giving children the best start in life to live happy, healthy, and hopefully for the children to reach their full potential.
Thank you, Denise. And now we will hear from Michael Caldwell. Michael, could you also please introduce yourself and tell us what your hopes are for Family Hubs and what difference you think they will make?
Thanks, Dina. Yeah, so I'm fortunate to be working with Denise as part of the evaluation that we're conducting. I'm a Professor of Education and lead for the Sheffield Hallam University evaluation as part of the DFE Family Hubs Evaluation Innovation Fund. You'll have heard from colleagues from Ecoris who are also working on that with other local authorities this morning. So we've worked with Doncaster for many years on lots of different projects, most recently the Early Years Outcomes Fund evaluation, and we've got lots of experience of evaluating programs with a local systems change focus. My work as an evaluator and as a researcher, I've done lots of work around using logic models, theory of change, theory-based evaluation, and generally models to evaluate quite complex programs such as this. And most recently, we use this approach to evaluate something you may have heard of that Save the Children worked on, which has got some parallels and some learning, I think. Their Children's Communities project, for which we used a maturity model. At Hallam, we are committed to working closely with local authorities in our area as part of our broader South Yorkshire Futures Civic University work, aiming to support the educational and wider outcomes for children and young people across our region. So we're really, really pleased to be able to work with Doncaster on this project. So what difference do I hope? I think I'm going to answer that fairly broadly, which is looking to the longer term. We would hope to significantly improve the life chances of children and young people, particularly those currently marginalised and disadvantaged. And in our evaluation, that's what we'll be hoping to look for and to learn about how that occurs.
Thank you, Michael. And our next speaker is Donna Molloy. Hello, Donna. Could you please introduce yourself and tell us what problems you think family hubs will solve?
Thanks, Dina, and hello, everyone. I'm representing the Early Intervention Foundation along with other colleagues today, and as you'll have heard, we're funded by the DFE to collaborate with and support the National Centre for Family Hubs. Our role is very much to provide the evidence about what has been shown to work in key areas such as supporting children's mental health, supporting parenting, family relationships and so on, but also crucially working with the National Centre to provide practical advice and support to local areas on the process of developing a family hub model or approach locally. So in answer to the question, I think, well, to state the blindingly obvious, what family hubs can achieve all depends on how they're designed and what services are offered as part of this approach. I think family hubs have the potential to improve an important set of crucial child outcomes. If they provide high quality, evidence-based support, family hubs can improve the quality of the home learning environment, improve children's behaviour, language development, reduce the risk of child maltreatment, and so on. And in particular, they provide a really valuable opportunity to reduce income-related development gaps in areas such as children's learning that we know open up early and really matter in terms of children's long-term life chances. But of course, achieving these results isn't guaranteed. Making a difference to outcomes is not easy, as I'm sure everyone listening today is well aware. And so if the Family Hub's vision is to translate into impactful services, we'd argue that local areas need to have a good understanding of the needs of families locally, including those who are less likely to access services, and be able to identify the services most likely to make a difference and focus on high quality implementation, which is why the support being offered by the National Centre for Family Hubs feels so important in terms of making sure this commitment makes the difference that we all want to see. And we and colleagues at EIF are really happy to be part of this and really looking forward to supporting the work.
Thank you, Donna. And last but not least, we will hear from Andrea King. Andrea, could you also please introduce yourself and tell us what difference you hope family hubs will make for children and families?
Thank you so much, Dina. So I'm Andrea King. Everybody, nice to meet you. I'm the new clinical director for the Anna Freud Centre, of which early years is one part of the clinical division. And we're really committed to the vision of family hubs, as you'll have picked up through the course of today. In answer to the question, Dina, I'm really hopeful and committed to the potential for co-production and co-design with local families through the Family Hubs agenda. I'm really hoping that together we can reach those families that just find it so difficult to ask for help, those who find it so hard to cross the doors of our services, and to be able to create an environment that's compassionate, that's welcoming, that's inclusive of all, and that provides a support that's available early in the life of the problem or the need, and early in the life of the child too. And we'll do that together through co-production and through partnership.
Thank you, Andrea. Thank you, everyone. I would like to open up the discussion to the audience now. If you have any questions, please pop them in the Q&A. Some questions have already been asked. So I would like to ask, here's a question for Denise. What are the key things that have been critical to enabling positive impact for families from your family hubs?
I think, as people have talked about already today, I think by having a universal offer to start with, that is a welcoming environment for families, and that's a place to start, and listening to the needs of the community, looking at the needs of what's there, and then developing a service offer around that. I think key is whole family working. So looking at the whole family, looking at the context in which the child is living in, what is impacting on that child's life. Is it mental health? Is it poverty? Is it health issues? And really looking at those issues so that we can then evidence the impact of that. I think the other thing is I think Andrea's just said, she's stolen my phrase about getting in early. So that's getting in early in the child's life, but also in the issue or the problem of where the child is. I think obviously partnership working is key to family hubs. And I think probably that's one of our biggest challenges. And if that's what I was doing again, if I was starting again, developing the family hubs, I would make sure that those partnerships weren't just based on relationships, that it's based on governance, commissioning, and really tightening up those procedures. That has been, I think, a particular challenge for us. But I think to evidence the impact of the things that we do, I was really heartened to hear Dame Andrea Ledson say about the qualitative as well as the quantitative. And I think it's the parents and children's voices that tell us what's working for them and what's not working for them that is so key. So when we're looking at our outputs and outcomes, we like to think of a basket of all the different things that we've got in there that matches the service delivery and the services that we've provided for the families and children of Doncaster. Hope that answers that.
Yeah, and is there anything you do differently if you were starting again to increase the impact?
I think partnerships are key. As I said earlier, I think it's partnerships that I would certainly consult with partners more. Perhaps that might be a mistake that we made, to make sure that they understand the value of the family hub, the value for us all. We had a saying in Doncaster when we first started, they needed to be on the bus with us. And I'm not sure everybody was quite sure where we were going on this bus. So I think if I was doing it again, it would be great to get them on the bus so that they can come on the journey to where we're going. And we're still going there. We're still progressing on our journey.
That's really interesting. Thank you. And Michael, maybe you want to take this question. What's the key learning so far from your work on family hubs?
Thanks very much, Dina. So at this stage, we're just in the kind of starting out stage of the evaluation, and it will have been mentioned this morning that our feasibility study report was just published today as well. So I'll refer to that a little bit. But I wanted to sort of take on one of the things that Denise just finished on there. What we've tried to do at the start of the evaluation, I think again this was mentioned this morning, is using an approach, a theory of change-based approach. You doesn't have to use that, but an approach similar to that, where you start to think through what are we trying to achieve, how are we going to get there, what resources are we going to use, what are we going to look for to see if we're going in the right direction, and actually working through that together as a partnership with a group of stakeholders, and almost the process of sitting in a room or on a Zoom call, working that through and surfacing where there's agreement, where there's tensions, where there's disagreement, that can really help in that kind of partnership building type approach. And it really helped us in designing the evaluation. I think the second thing, and again, Denise mentioned the basket of indicators there. Anybody who has heard more previously from Denise and from the team at Doncaster. Doncaster's really data rich, and it's, you know, data of all kinds, from engagement, intermediate outcomes, being able to map onto longer term and higher level outcomes as well. But we wanted to focus, I think, on a couple of issues, and again, maybe the learning here could be something we could support and work with the wide learning from the Anna Freud Centre as well. Firstly, looking at strengthening data and intermediate outcomes, working on enhancing an already developed survey so that we can use more robust measures as part of that, to help us with understanding some of those intermediate outcomes, particularly around family and children well-being measures. And secondly, focusing down on what are the clear impact measures, what are the ones we really need to focus on to ascertain impact, and what kind of ways can we do that. And in our evaluation, we're not looking for a one-size-fits-all. We're trying to use, where we can, different kinds of comparators. We're not using randomized control trials in ours, but also theory-based evaluation. You know, what is the theory? What does the theory tell us we should see if things are succeeding using these measures? And I think just two final things. One, just again, reiterating what Denise said, the implementation and process evaluation, the direct work in the family hubs to understand what's going on is really crucial. And to help us with that, we're really, really delighted to be working with a peer researcher. So this is a member of staff within Doncaster working with us on helping to design, deliver, and work on the evaluation. So those are things that I think are sort of interesting learning for how we're designing the evaluation going forward, and really, really looking forward to continuing it.
That's really interesting. We know you will be looking at value for money as part of your evaluation. Can you also tell us a little bit about that?
Yeah, just very, very briefly. So I'm not the expert on this in our team. There's a lot of great information in our feasibility report, just very broad brush terms, I think. So we'll be looking at identifying and then quantifying the inputs and resources. So we're talking about staffing and non-staffing. I think it's important to be able to do that, because Doncaster, as I've mentioned earlier, is very data rich. We've got a good start on that. We also need to be able to assess the contribution of other not so direct services. So where there's inputs, for example, from voluntary sector services, things that might not be so visible. So we need to try and surface those and work out a way of deciding to what extent, how we would cost both those direct and those indirect outputs. And then once we've allocated, looked at the costs, obviously we need to look at those outputs and outcomes we just talked about. And again, for example, typically outcomes for individuals that are benefiting, but also more broadly, perhaps for the wider area, allocating those to these inputs, and potentially doing that on a site-by-site level. So being able to see, you know, are there particular sites, particular hubs which are performing differently than others using this method, and absolutely crucial in that is identifying differences in needs. So it's not the case that every family output or engagement is the same, because there may be some that have got much greater, more complex needs and are being reached and provided services, and others who, you know, who perhaps are a bit easier to reach and work with. So we need, on it from a cost benefit perspective, that's something we need to work through, and then using the methods I just talked about in my previous answer to try and measure the additionality. What is it that is going on over and above what we might have expected without the family hubs? And then we can use that valuation method to put a kind of number on it. But more detail from my colleagues, and I hope if there's any questions on that, forgive me already for me being fairly broad in my answers.
No worries. Thank you. Thank you, Michael. Marc, what's the difference between family hubs and Sure Start?
Hi. So I might just actually very briefly pick up on something that Michael has said there, as before I answer this one, because I was asking my answer, the sort of one sentence answer about the difference that family hubs can make. And problems they can solve. And Michael has just mentioned the document, which the Minister also mentioned, that we published on the work we've been doing with evaluation partners and local authorities, which is almost, if you like, 164-page answer to that question at the very opposite end of the spectrum from the one sentence pitch. And I would commend it as an example of the kind of co-production between central government and local areas that Andrea mentioned, Andrea King mentioned early on too. So the difference between family hubs and Sure Start. So the thing I would say, first thing I would say, is that we and the local authorities we have been working with, we very much see family hubs as building on what has been learned from Sure Start, rather than something we should see as a completely different sort of intervention. And of course, Sure Start itself evolved considerably over time and varied a lot from place to place. So, you know, I'm cautious about making a really simple comparator. One of what we can say is that the sort of simplest central difference is that family hubs bring together services to support families from conception, with that strong emphasis on start for life, all the way up to young people of 19 or 25 special educational needs. And the Minister sort of set out in his speech how local authorities, say we've been working closely with over recent times, are using that approach to then improve the quality of the service offer through that greater integration across those principles which we've spoken about. So, I mean, I think the actual truthful answer is quite complicated in terms of, you know, the difference, and you need to get stuck into it, which brings me back to the document I mentioned at the start, where we are really getting into the detail of how local authorities are approaching this challenge, and we're working with them.
Thank you. Donna, what is your view about the quality of the evidence base around family hubs and integrated family services?
I think, unfortunately, the evidence in this space is much more limited than we would like. Generally, there's a lack of national monitoring or evaluation about the impact of family hubs and integrated family services more generally. And we often see that attempts to review the evidence in this area do time and time again tend to find little empirical evidence of impact on child and family outcomes, although there is a body of qualitative evidence which tells us that families and practitioners involved in delivering these services are very positive about them, as Denise and others have mentioned. And I think much of this is because robust evaluation of complex community-based systems which involve multiple agencies is very, very difficult. It's much easier to evaluate a very specific intervention. But this lack of evidence is important, though. We did some work last year to look at different models of children's centres and family hubs, and found it was very difficult to say what works best or how different versions might compare in this space. And there's been obviously a range of different local approaches and experimentation, but often without a common language or set of metrics. And so it is very difficult currently to assess the impact of different approaches. So this is why Michael's work and some of the work that's been taken forward now feels so important. And it's really important as we take forward these new commitments and deploy new funding, that we do take the opportunity to really start to advance the evidence in this territory. And as Michael has said, really important to think about how we might develop more innovative evaluation methods, because some of the approaches and activities in this territory are just not well suited to traditional methods of impact evaluation.
Thank you. There's a lot that we know from the evidence about what works to improve outcomes for children and families, but there seems to be a gap between what we know and what we do. What do you think are the barriers to implementation?
Difficult to do this one briefly, but certainly there is a big gap between what we know from evidence and what gets commissioned and delivered for a whole range of reasons. A lot of this is about constraints on resources. Many evidence-based interventions are expensive. There's often sometimes ideological barriers and a preference for locally developed services. But I think perhaps more fundamentally, engaging with evidence and implementing effectively isn't easy, and it takes time and capacity, and improving outcomes isn't as simple as doing what works, because nothing works everywhere and in all situations and for all children and families. And so improving outcomes in this space involves carefully considering the evidence about support that's had an impact with wider considerations, such as whether something fits with a specific local context, population needs, the workforce that's available to deliver it, and so on, and the conditions that are required for implementation in order to decide what to do. And this is the really hard bit. And sometimes local areas lack good quality information about the current system and what might need to change. And often the time and capacity to think this through is in short supply when people are involved in trying to run a busy service and so on. So I think that's why the support that's been developed to help local areas both identify the problems that they want to solve through developing family hubs approaches and specify the services and interventions and activities that will be included as part of that offer feel absolutely crucial as part of this process.
Thank you. And Andrea, how can family hubs tackle the hugely disproportionate impact of the COVID-19 pandemic on children and families that face marginalization or other vulnerabilities, you think?
It's a crucial question, Dina. I can see some of that coming through the questions we're receiving in the chat at the moment. I mean, the key thing to say is that the impact of COVID has been extraordinary, hasn't it? And particularly the impact for families living in poverty has been really significant. So it's exacerbated those gaps that we already had, as Peter Fonagy so clearly described this morning. I think when we then turn our gaze more widely, and Dame Andrea Ledson's talked about this so clearly, to thinking about the breadth of protected characteristics and the experience of exclusion and marginalisation and othering in society, which has worsened in this period. The impact of that is very real, both at the time and later through life as well. So being able to agilely respond to these things is really important. We might also want to add to that neurodiversity and SEND and disability as crucial considerations for us in this time. So perhaps our starting point is to say, let's have that at the front of our consciousness when we're doing this design work around family hubs. You've got the evidence base of analysis that in JSNA, in the needs analysis, in local transformation planning, that's really helpful. You've got the evidence base in qualitative audit work, but there is nothing that substitutes a conversation with the people who are affected by these situations and these experiences. Our babies, our children, our young people, our parents and our carers. So perhaps a few reflective questions are important. As a leadership system, strategically, how representative are we? At local level, at national level, how are we enabling that voice to be heard? As we look through the eyes of our children and our families, how hard is it to ask for help? What can we do? What can we co-design together with our experts in the community, in our voluntary community and faith sector provision particularly, who will be living this every day and will have expertise to bring? What can we do together in partnership? How hard is it to walk through the door of a family hub or any other set of services and begin that relationship? What can we do to create a more welcoming environment? Do we rely on people coming to us? Can we outreach, as Dame Andrea Ledson described it? What does that look like? Who do we partner with when we do this together? And what that comes back to is honest relationships, where we can talk about the things that are hard. We can talk about the reality of what it's like to be in our children's lives and our families' lives at the moment, and co-design how we can work together to improve that through family hubs.
Thank you, Andrea. We have a question for Marc. When will the 82 million of funding announced last week be available? How will the government decide which local areas receive funding, and what will the application process involve?
All splendid and excellent questions, and I'm sorry to have to disappoint with a kind of classic in due course civil service answer. But so that, I mean, the one thing to say that when will it be available? Well, the announcement last week was about the spending review period. So we're looking at the next financial year and the 3 years hence. So that's when that will come into effect. But obviously, yes, everyone will want to know the answers to those questions, and I think we are absolutely going to be working on that as fast as we possibly can. But at the moment, I can't give you any further information as to how we'll be selecting areas or taking that forward. But you can rest assured that government is very keen to move quickly. You've heard from the minister, you've heard from Davidson. We won't be hanging around, but we'll provide as much information as we can as fast as we can.
Thank you. Maybe you can answer, could you outline the relationship between the supporting families outcomes framework? Will there be an expectation that this will underpin the family hubs model?
So again, supporting families, of course, there was the announcement last week of the extension of that programme, hugely important programme for government. And absolutely, so we are the Department for Education. Supporting families is normally led by what we now like to call DLUC, DHLUC, local communities. And yeah, absolutely, I think we are really conscious that as we move forward with family hubs, for local people who are implementing all of these things, we need to be coherent out of central government. And I'm happy to say that we're working very closely with our colleagues at DLUC. I think that's like all of these things I think we've spoken about today. This is an early step on a journey we're all going on, and I think there's a lot of commonality between the way in which we talk about family hubs and the things, the material we've seen put out today, and the kind of work and approach that supporting families has had over the years to rich transformation funding. So I think there's a lot of commonality between those two things. And again, yes, outcomes frameworks. I don't see any tension in the way that these things have been set up, but we are still got, I think, work to do to make sure that this is received by people on the ground in a way which is coherent and joined up. And what I say, we're working with our colleagues over there on that. And there's obviously in the material we produced today, there's lots of specific emphasis on the Supporting Families Programme and how it comes together with family hubs. So more to do, I think, but we are absolutely on that, and I think we've made a good start.
Thank you. Andrea, there's been little said today about school-age children and where schools, youth work, youth justice services and so forth fit in with the Family Hub's vision. In addition, little has been said about reducing parental conflict work, which affects children aged across the 0 to 19 age range. Do we risk drawing all our resource into early years to the detriment of older children, you think?
Excellent set of questions. There must have been about 5 questions in that, Dina, so forgive me if I don't quite cover them all, but I'll do my very best now. So in terms of our clarity together today, I think we've been really clear that the whole suite of children's needs, from infants all the way through to young people and transitioning into adulthood, is absolutely on the table for consideration today. That's part of what makes Family Hubs quite special. The role of schools will be crucial, and for colleagues sat in the strategic leadership arrangements at local level, you know how important those conversations with school colleagues are, head teachers and governors and leadership teams. Also, schools will have a different insight into what it feels like to walk in our children's shoes every day, and are often a relationship of trust that's unique and pivotal. For those children that fall outside of our mainstream education, the relationship with alternative education is also really, really important. In terms of parental conflict, we talked earlier about the joint working. So Marc and colleagues have been talking about the joint working with DWP colleagues and the fact that more resources are being made available on that. They'll be coming online very soon. Additional training is scheduled on this particular area because it's so important. Thinking through to the spectrum of youth justice, there's a real connectivity there. And your youth offending colleagues will have a specific input to offer, which is looking back at the lives of the children and young people that they know very well, what would have made a difference to them in terms of early intervention and support for families. So they'll be crucial stakeholders in this conversation.
Thank you. Donna, someone from the audience says, I agree with local identification of needs and prioritizing services based on those identified needs, but how do we ensure consistency and ensure public money is being spent on evidence-based programs to support the most vulnerable in our society across the country?
I mean, I think the balance of focus and resource on universal or more highly targeted services in each version of Family Hubs will differ depending on wider services, what's available already, and what the need profile is across the local population. So I think, they are decisions that need to be taken at local level. I think organisations like the Early Intervention Foundation and Anna Freud can do centrally is make sure the best evidence about what makes the most difference in terms of specific child and family needs is synthesized, brought together and made very accessible, so those making decisions can draw on that as they design and plan their particular local model. And there's various activities going on at the moment to think about how best we pull all of this together and make it really easy for people to refer to and use as they make those decisions and judgments about how best to deploy new resource and what the best fit is with the offer they have currently.
Thank you. And there's a question for the whole panel. How will Family Hubs contribute to addressing problems of family marginalization and racism? Who would like to take that question?
Dina, could you mind if I just jump in and just follow on from Donna's point, and then I'll let other colleagues go into that, which is I think there's something, I think, from what we know about the implementation of informed practice, I think the role of mediation and brokerage is really, really important in bridging that gap between the evidence of what we know works and local implementation. And so I do think the role of the EIF and the Anna Freud Centre is important, but I really, really think the role of local authorities to support one another in helping to understand how to do that, and potentially looking at more kind of localised brokerage as part of that should be something that we ought to look at. Sorry to jump in on the question, but I just wanted to add that on to Donna's last point.
No worries. Does anybody want to chip in on their views on how will Family Hubs contribute to addressing problems of family marginalization and racism?
I could go partway to answer that, Dina. In Doncaster, we've got a very small BAME community, mainly sort of white British, but we have got a couple of pockets within Doncaster. And what we've done in those areas is we've actually gone out into those areas, because it's actually probably not a mile away from one of the biggest hubs in Doncaster. But we realised that these families aren't coming into the family hub. So we've taken services out to them wherever they meet. It could be on the street, it could be outside a shop, it could be wherever. And that's where we've consulted with those families to ask them using interpreters. We've done lots of interpreting of leaflets and so that they can understand the things. So that's helped us to understand what they like, to then begin to integrate them into the other family hub services. And it's all about building that trust up, isn't it, with any family, building that relationship, building that trust. So that's what we've done in some ways, because it was quite a marginalised, and still is, to be fair, this community. But we have got some families that have started to attend family hubs.
Thank you, Denise. Another question for Marc. Will family hubs become statutory provision, and will there be any inspection of family hubs?
So, I mean, local authorities have duties under which and powers under which they are taking forward all of these services, and so a lot of what is done through the hub already has this kind of underpinning. I mean, interestingly, the conversation just then about the trade-off, if you like, between prescription around what can be said to be heavily evidenced things that work versus the need to allow local service delivery to allow provision to reflect populations, to allow for innovation, and the kind that has spawned family hubs is one of the sort of tricky things, if I'm being completely honest, about how you build a government programme here. You know, what an inspection is a sort of, you know, is absolute accountability for outcomes and for this public money, and all of these things are incredibly important here. And inspection is one of the tools that you use to sort of at the more prescriptive ends, like, you know, we know what should happen, and therefore we are putting in place a structure to sort of drive that through. And I think, you know, what I would say about the family hubs work, I think we've all said, Minister said this, like, well, you know, we're on a journey, and this is a kind of an important day, an important moment, but, you know, we've got years of work ahead of us. And I think like a lot of what we're doing at the moment is production, a lot of work on the, so for example, I've mentioned the evaluation. All of this is designed to improve our kind of knowledge of what is happening now and what the best practice is as we move through with family hubs over a period of time. And I hope that this is a policy that goes on for a programme of work that goes on beyond the kind of horizons that government can ever talk in. Yeah, you may find yourself, you know, bringing in sort of more prescriptive options, of which inspection will be one. I mean, at the moment, you know, I don't think we have plans to impose an inspection regime or bring that back around, specifically around family hubs. And the accountabilities that exist are the ones that are there in the system at the moment. So not yet, but I wouldn't say that forever, you know, the answer would be no.
Thank you. Could you also tell us, how do you think family hubs will link in with children's social care?
So, I mean, Camilla in her presentation sort of talked about where family hubs are kind of, are essentially targeted. But of course, you know, safeguarding has to be absolutely core to what anybody does who is working with families or with children, or in fact everybody, you know, has to have that in the front of their mind. So the connection around, the principle around connection is where we would say, you know, is that where the right response to a problem that, you know, arises, or a circumstance arises in the course of work that might be in the sort of more universal space, requires a response from, you know, from children's social care, from social work, or escalation. You know, it's absolutely crucial that that referral pathway and the join up between the front door and the statutory safeguarding services is absolutely clear. I would, you know, I think that whilst family hubs are, you know, as Camilla said, you know, targeted and attempting to support families in one kind of way, that connection into those services got to be central and clear and robust.
Thank you. Andrea, somebody from the audience says, we all know that evidence-based support works if delivered to a quality standard, but there are many programs and approaches that are not yet evidence-based. Will there be any support from the National Centre for Family Hubs for developing the evidence base where early signs of impact are good?
Yes, thank you, Dina. And I think Marc has already alluded to this in his most recent answer. So thank you, Marc. There's a balance to be struck between the evidence base, which Donna has described so clearly, and the opportunity to innovate in response to both local strengths and capabilities within the partnership system, and what, most importantly, what our children and families need. So the opportunity and our commitment in terms of the National Centre for Family Hubs is to partner regionally and to enable that support for you to be able to respond locally with innovation, whilst keeping an eye on what's the impact. How will we judge the effectiveness of this? And I think Michael's described ever so clearly a kind of nuanced approach to that as we pick up new and emerging innovation from the Family Hubs model.
Thank you. And Denise, someone would love to hear more about integrating the faith, community and volunteer sector into family hubs. Some participants are saying how hard it can be to ensure good partnerships between local authorities and the sector. Could you say something about that, please?
Actually, that reflects back just on the point I made previously, because it was the faith and voluntary sector that helped us to integrate with the other communities that I was talking about earlier. So that's one of the ways where we've worked together, and they're just one of our partners. I think I saw on some of the diagrams earlier this morning, people have put different partners, and certainly voluntary and faith groups are part of our offer. I wouldn't say it's fully integrated, and I think that's an area perhaps we need to develop further. But we do work closely with some in certain areas, and we do have voluntary groups that deliver youth services in particular.
Thank you. Donna, you wanted to elaborate a little bit on what Andrea said about developing the evidence base. Do you want?
Yeah, I guess to the point about support for evaluation locally is really well made, because obviously developing better knowledge about how best to support children and families in the UK isn't just about top-down, centrally commissioned, robust impact studies, and there are huge swathes of innovation and practice developed locally that haven't been tested, because evaluation is hard and takes time and resource and capacity and all of those things. And so a crucial part of not just the family hubs agenda, but more generally work across a whole number of central government programmes in this space has to be about supporting evaluation locally, helping those developing local services specify the outcomes that they're trying to change, how they're going to do that, and what they can measure. And certainly at EIF we have a number of programmes which are working in that sort of way, as do many other organisations. So just to say, I think, you know, this is absolutely crucial as part of developing this whole agenda.
Yeah, someone is saying evaluations are complex. Please keep it simple. Let us spend time developing relationships with our partners and parents, and in delivering against what we already know is needed.
Yeah, I mean, just on that, of course, I mean, evaluation has to be proportionate, doesn't it? And there are we don't need to evaluate everything, and there are certain things we know, and we don't need to constantly reinvent wheels and so on. I think all we would say about that is where there is significant investment which is aimed at changing a specific outcome or set of outcomes for children and families, it is important that we know if that's actually happened. So we just need to make sure we organise this in a way that allows us to learn what's been achieved along the journey.
Thank you, Donna. Well, with that, I would like to thank you all, in particular Marc, Denise, Michael, Donna, and Andrea, and everyone else who contributed, as well as Paul, for being the chat host at this event. I would also like to send a huge thank you to Camilla and Claudia and their teams and the event team for organizing this fantastic event. And I would like to thank the audience for joining us. I hope we've given you food for thought and some inspiration. I'll now hand over to Dr. Camilla Rosen, the head of early years and prevention at the Anna Freud Center, who's also the strategic lead of the National Center of Family Hubs. Thank you.
Thanks so much, Dina. That was a wonderful and beautifully chaired panel, and some really, really helpful and some challenging and important questions there. As ever, throughout the day, we will aim to collate all the questions that we haven't managed to answer, and we'll kind of put them into a question and answer document when we share the recordings of today. So we're coming to the end of what's been a very busy and engaging day, and it's been a very exciting one to kind of bring together the last 6 months of work, but also start, you know, the journey of next steps and how we take all of this work forward. So thank you everybody who's joined us today for all the engagement and the hugely valuable and important kind of questions that's going to really help as we define things going forward. So I just wanted to finish the day by sharing some slides. Okay, just to remind people about how they can get involved and connect with us. So as I mentioned when I started, for those that weren't there, we have launched our new website today and some of the initial modules of our toolkit, which is on www.nationalcenterforfamilyhubs.org.uk. So please do check us out there. We also have a a newsletter which we're circulating every 6 weeks, Family Hubs in Mind, and you can sign up for the newsletter on our website. You're going to get all the updates on our latest resources, events and news, and we'll definitely signpost to the recordings for this event and the FAQs. You can get in touch with us directly on our email, ncfhinquiries@annafreud.org, or our telephone line. And I guess particularly now we're moving into the next stage of our work, which is the kind of direct work with local authorities who are wanting to set up and deliver their family hubs. So if you are a local authority or family hub provider that are interested in working with us, then please get in touch. And that's when we're going to aim to allocate regional coordinators. And just finally, to flag our next upcoming events. So we have an event coming up next month on the 2nd of November, which is our Reducing Parental Conflict and Family Hubs webinar. So that's really going to be showcasing how we can bring the Reducing Parental Conflict programme and how it will work with family hubs. And Patrick Myers, who's a wonderful colleague and a very impressive advocate for reducing parental conflict, is going to be co-facilitating that with Dr. Emma Morris, who's one of our wonderful policy and practice advisors for reducing parental conflict. So I think it'll be a really helpful event, and hopefully we'll speak to some of the questions people have had about how the Reducing Parental Conflict programme fits in with family hubs, because it definitely does. And then we'll have a webinar on the 9th of January that will do a very similar thing, kind of really showcase what family hubs can do to support implementing the Best Start for Life policies. So these events are, you can book them on our website, and we'll signpost to them if you sign up to our newsletter or get in touch with us. So it's nothing more for me to say now other than another huge thank you to everybody. All the people that spoke today, all of you that engaged and came along, everyone else behind the scenes that's been working on making this a reality over the last few months and fairly tirelessly in the last few days. It's really, really very appreciated. So thank you all very much, and I hope you enjoy the rest of your day.